So another 3 weeks of lockdown in the UK. It is a very big decision, but what's the data that underlies it? We can give you a sense of what's going on in the UK by having a look at some of these numbers. You're probably familiar with this chart already, showing you the death tolls in various different countries around the world. A very depressing chart. It's a logarithmic chart, so essentially the steeper these lines are, the faster those rates are growing, because this is a disease that spreads exponentially. We'll get onto that in a second. But focusing on the UK in particular, we now know we're up to 13,729 deaths in hospitals. So that's in hospitals. It's a terrible number, but as I say, it would have been a lot higher had growth rates continued the way they were early on after the lockdown. They have come down quite a bit, and I'll show you a chart that illustrates that in a moment. But that's just hospital deaths. We're now also getting a sense of what's going on elsewhere around the country, in care homes, in private homes. And the government has just produced this data series showing you all deaths in all settings. It's not very timely, so it's kind of a bit out of date. But what you can see is that line is above the hospital death number. And so what that means is the picture we're getting every day from the government is an understatement. It's understating the true number of people who are dying, and we won't know for quite some time what the grand total is, except that it is much higher than anyone would like. As I say, though, these lines are cumulative totals, but they don't really show you when the numbers start to fall very well. So I've got a different way of showing that. Basically, it's daily deaths. It's a 7-day average for all these different countries. And let me give you a sense of what we're talking about by looking just in particular at the UK. You can see that line is starting to flatten. So the number of people dying, it's a 7-day average, so smooth it out, is now basically pretty flat. And in countries like Italy and Spain, you can see it's actually come down from the peak in those countries. But there is definitely a place that stands out and having a very different story. And have a look. This is the US. And look at that line. Rather than flattening like those other countries, it's continuing to rise. And as I say, these are logarithmic charts. If you had a normal chart with a normal axis, you'd see that kind of going up into the roof. So a very big increase in the US still at the moment. But it isn't just these lines that the scientists are looking at when they're deciding about lockdowns. It's also other indications. It's this statistic in particular, the R number, the reproduction rate of the disease, and just how many people it is being passed on to on average. So initially, the modelers said that it was about 2.6. So every one person who got the disease, 2.6 people would get it from then. They'd be infected. So you go from 1 to 3 to 9 potentially, and before long you're talking about tens of thousands, hundreds of thousands even. That's what we mean when we talk about an exponential increase in this. And the good news is that the modelers at Sage think that it has got down to below 1. And why is that important? Well, look at the lines. Look at the number of people who potentially get infected here, those white people. It's just 1, then 1, then 1. You're not getting that exponentiality, the big spread in the disease you might have had before. That's not everything, though, according to Sir Patrick Vallance.
The social distancing measures that are in place need to stay in place in order to reduce the numbers of people with the infection in the community. That allows that's because the R comes down, but it's also the absolute number that needs to come down. So we've got fewer people carrying the infection.
Now, in some countries, like Germany, they're doing a lot of testing, and that's important because it gives you a sense of what that R number is. If you're not testing, you don't have as much of a sense of that. And in the UK, they said that they were going to get up to 100,000 tests a day, but look at where they are. The top of that axis is 100,000, and you can see we're still down at around, actually below 20,000 tests a day. So potentially the government really needs to get those numbers up so that it can get a sense of what the R number is and decide on the next phase of the lockdown. And that matters for everyone, because this isn't just about public health, it's also about the economy. And have a look at this chart showing you unemployment claims across the economy over the course of the last few decades. So it goes all the way back actually to 1983. So you've got the early 1980s recession, Black Wednesday, 1992. You've got the financial crisis there. And look at the spike recently. The COVID-19 spike on universal credit claims is higher than any other period since the creation of the welfare state. It underlines how much trouble the economy is, how much pain people are feeling financially, and the longer the lockdown goes on for, the bigger the problem there.